Welcome to my video. This is Jung-Yu at MDREX. Today's topic is about medical materials value appraisal system in Korea. I'm going to start with brief definitions about concepts and terms related to value appraisal, followed by introduction to the system and case studies. Let's get started. First part, definitions. First of all, who are governing the reimbursement system in Korea? Ministry of Health and Welfare is the top-level body governing national health insurance. In Korea, medical reimbursement is based on single-payer system, which is NHI. The NHI fund covers up to 80% of the medical expenses for surgical procedures and separately listed medical materials. To run the system, MOHW delegates its authority to review and assess reimbursement-related issues. So HIRA, Health Insurance Review and Assessment, has been set and acts as the frontline body. Then, what are medical materials? There's no specific definition defined by law, but medical consumables, non-pharmaceutical products, and human tissues used for diagnosis or treatment of in and out patients are deemed as medical materials. Those materials are mostly included in the reimbursement for surgical procedures, but some of them are listed for reimbursement separately. Similar concepts in the world are DMEPOS in USA, prosthesist PL in Australia, and 의료자료 in Japan. There are three types of reimbursement depending on the payment ratio, government to patient: reimbursable 80-20, selective reimbursable, and non-reimbursable. The type is determined through HIRA's review on effectiveness and cost-effectiveness of the technology or medical material. For medical materials, maximum reimbursement price, MRP, is determined as well. When the reimbursement decision is finalized and approved by MOHW, it is announced and notified on a regular basis like this Excel file. The listing structure consists of 16 categories by medical department and purpose of use, each divided by groups per form, materials, working mechanism, size, etc. Now let's move to the next part. Here I will introduce about the overall reimbursement decision process for medical materials and value appraisal. This is a visualized chart about market entry procedure for medical device. Detailed explanation about each step can be found in another videos at MDREX channel, so please feel free to explore around. Here, what I would like to bring your attention to is this red box on the right bottom, premium price through value appraisal. As its name suggests, it is a strategical pathway for premium price for medical materials. Through this pathway, a medical material can be listed with recognition of its value, and finally higher price than other existing materials can be applied. Then let's see more in details about it. Not all the medical materials can be applying for the VA, of course. Then what is the eligibility? First, purpose of use of the target material should be the same one with the existing item. This means there should be something it can be compared to, and the purpose of use comes the first to check this eligibility. A totally new medical device whose purpose of use is really new cannot apply for the value appraisal, but it will rather be reviewed and assessed by another criteria. Now, second, as you could guess, comparison data should be presented as evidence. This is to prove the target material's improvement, which here I suggest to say value. Depending on how much and significant value the target material can bring, applying a premium price or not can be considered. What type of evaluation are there for value appraisal then? There are two, depending on the type of evidence. First type is evaluation on innovativeness. This type requires clinical data about direct comparison with existing material. The documents for submission shall be in form of published literature that went through peer review or documents that meets requirements for product approval. This evaluation allows from 10 to 100% of increase, again, add-on price. Let's take an example. Let's say there's a material group with MRP with $10 US, and a new medical material comes in with the same purpose of use, but the VA was approved. Then the price can be ranged from 11 to 12, 20 through this innovativeness evaluation. Second type is evaluation on technological improvement. This evaluation requires technical files with technical data that shows improvements compared to existing materials. Published clinical data that is not peer-reviewed or preclinical, in vivo, in vitro studies can be also submitted as evidence. For this track, 10 to 50% of increase can be made as add-on. So from the previous example that I brought, 11 to 15 US can be determined. For value appraisal, there is a scoring system implemented with 3 criteria. They are clinical usefulness, cost effectiveness, and technological innovation. As you can see, the clinical usefulness is the most important and biggest part in value appraisal scoring system. While cost effectiveness and technological innovation criteria have the same evaluation item for both types, and they can only get up to 16 points. Clinical usefulness has different scoring system as well as evaluation items for two of the types. To compare, in innovativeness evaluation, it more focuses on actual effectiveness and other values regarding to post-treatment effects. In technological improvement, it simply focuses on improvement in functioning and how easier and better the treatment can become by using the target material. The total point is matched with add-on rates, and the minimum points to obtain the add-on price is 20 points. This is a table for both evaluation on add-on rates. As mentioned in previous slide, through innovativeness evaluation, from 10 to 100% of add-on is possible, while up to 50% of increase for technological improvement is eligible. Now, let's take a look at the application system. Value appraisal application is made through HERA work portal. Here, value appraisal application does not stand alone, but the same one with medical material determination form. There is only one form on the system, one application on the system for medical material reimbursement application, so the type of appraisal should be marked. They are the major parts to be filled in for VA application. First, product information. Here, as VA is for premium price, desired price should be entered. Second, relations with pre-listed materials. As we discussed previously, VA is eligible for materials that have the same purpose of use with existing materials. Therefore, in this question, is there any pre-listed material that has the same purpose of use? The answer should be yes. Third, attachments. Aside from the essential documents to be submitted, such as product license and evidence on desired price and cost effectiveness, all the rationales can be submitted for proving the values. Last but not least, the type of application. For value appraisal, either innovativeness or technological improvements type should be checked under general assessment. To do this, assessment with priority should be checked with no first. But for reference, I added examples of evidence that can be submitted for value appraisal. Please feel free to capture it if you like. So how an application for VA is reviewed? As explained in previous slide, the application should be marked as for VA. Other than the evidences for value the desired premium price, evidences for clinical usefulness also should be submitted. In the first day by HERA admin, this kind of very basic eligibility check is done. They are such as see whether all the requirements documents were submitted or not, and if the application is not eligible or incomplete with documents, HERA admin notifies the applicant immediately so that a new application can be made, or non-eligible one can be switched to general application. When it is deemed eligible, the application is recognized by Medical Material Assessment Committee in HERA, which calls VA committee meeting. In VA committee meeting, the members review the application's eligibility more in depth and finally evaluate, determine its points based on the scoring table. When a decision is made, it goes back to Medical Material Assessment Committee for approval. If it is rejected, it can be reviewed by VA committee once again. If approved, it is ready for MOHW's official announcement. Thank you for staying with me so far. With the information I explained, we will be taking a closer look on the real-world examples that successfully made it to pass VA. The first case I prepared is a VA through innovativeness evaluation. This material is a class 4 medical device in Korea with purpose of use to replace malfunctioning congenital or prosthetic aortic or mitral valves. It has successfully been listed with 40% of premium price in 2022. There were 10 items listed in tissue heart valve group at that time with MRP of about $2,160. In order to be listed with premium price applied, a VA application was made with 2 clinical literatures submitted. One of them was meta-analysis, and another one was retrospective cohort study, which are regarded as high level of clinical literature quality in evaluation. The appraisal comment from VA committee is here. It recognized the material's clinical usefulness, improvement in long-term performance due to several factors and cost-effectiveness, cost savings achieved from reduced weak operations and extended lifespan. Although technological innovation is not recognized here, the total point was already 52.17, which is met with 40% of add-on price. In conclusion, by submitting 2 high-quality literatures that prove the target material's clinical usefulness and cost-effectiveness, the MRP has been determined much higher than pre-listed materials through VA. Of course, not only simply submitting the literatures, but also including summaries and analysis to help supporting the applicant's rationale is very important. Second case is implants used for arthroplasty of artificial hip joint in orthopedic surgery manufactured using a 3D printer. Those products were in acetabular component groups in medical material list and passed VA through technological improvement evaluation in 2020. Submitted and reviewed material was a published literature on comparative analysis that analyzed several 3D printing cups and compared their design. The committee recognized that those cups' improved function proves benefits using the cups rather than the other cups already listed, such as increased fixation strength, cost saving from not needing bone cement, easy of procedural with shortened time, etc. As conclusion, one multi-hole TT acetabular cups earned 23.17 points, which is matched with 10% add-on range. And the revision TT cup earned 40 points, which takes 30% of the increase. So this is it for today. If you're interested in value appraisal or have any follow-up questions, please feel free to contact MDREX at any time. Thank you for watching. Bye-bye.